This is Janet Hildreth, week 7 homework video discussing diffusion weighted imaging and functional MRI and perfusion imaging. So diffusion weighted imaging, diffusion is described as the movement of molecules in the extracellular space due to the random thermal motion. This motion, however, has restrictive boundaries, either by ligaments, membranes, or macromolecules, tissue structures, and in some cases, pathology. The net displacement of molecules diffusing across an area of tissue per second is called the apparent diffusion coefficient, or ADC. In diffusion imaging, normal tissue that has high ADC has a lower signal intensity than abnormal tissue that has a low ADC because of the molecules within are free to move. When a pathology is present, diffusion is restricted. A diffusion gradient is applied along 3 axes, either together or separate. This is particularly useful when trying to image white matter in the brain because of individual acquisitions with different gradients to image along a particular axis. These tissues are known as anisotropic, where gray matter is isotropic. In DWI, fast spin echoes are commonly used with gradients on either side of a 180-degree RF pulse because other types of motion need to be reduced in order to measure the motion from diffusion. 2 types of diffusion-weighted images are the diffusion or trace images, where damaged tissue has restricted diffusion or a low ADC and is brighter than normal tissues, where diffusion is free, which has a high ADC. This is because the spins in the restricted tissue stays put, and so the signal is higher and it appears to be bright. ADC mapping is acquired in post-processing by calculating ADC for each voxel of tissue, allocating a signal intensity according to its value. Contrast here is opposite, so low ADC is dark, high ADC is bright. This is useful for T2 shine-through, where ADC maps is used to determine an area that have a low signal or a long 2T decay time. Diffusion-weighted uses is most commonly in imaging the brain after an infarction. Because of the cells swelling and absorbing water, diffusion is restricted and ADC is reduced. These areas appear bright and can be caught sooner than on conventional MRI techniques. They can be used to differentiate malignancies from benign lesions and tumors from edema and infarction because they all have different ADC values. Diffusion tensor imaging allows for very detailed imaging of white matter and may enable the use of diffusion weighting to image certain white matter diseases. Perfusion imaging is a non-ionizing technique with high spatial and temporal resolution that may be co-registered with anatomic information. Perfusion is the regional blood flow in tissues and is defined as the volume of blood that flows into 1 gram of tissue. It measures the quantity of vascular supply to a tissue as well as tissue activity. It's measured by tagging the water in arterial blood during image acquisition. Tagging can be achieved in one of 2 ways: by bolus injection of contrast such as gadolinium, or by saturating the protons in arterial blood with RF inversion or saturation pulses. Since gadolinium shortens T1 recovery, visceral structures with high perfusion appear bright on T1 weighted imaging, fast gradient echoes, good to visualize kidneys, liver, and spleen. Gadolinium bolus injection during an ultra-fast T2 or T2 star decay causes decreases in T2 and T2 star decay in and around microvasculature perfused with contrast. After data acquisition, signal decay curve is used to ascertain blood volume, transient time, and the measurement of perfusion. This is known as time intensity curve. Arterial spin tagging is another technique. Arterial spins are attenuated by inversion or saturation pulses outside of the field of view. This is a non-invasive alternative to using contrast. Perfusion imaging uses. These are used to evaluate ischemia disease or metabolism at rest or during exercise. The malignancy of neoplasms can be reflected in increased tissue metabolism or perfusion, and CBV mapping lower perfusions appear dark, such as stroke, but higher areas appear bright, such as malignancies. These techniques are good to evaluate tissue viability and metabolism of vascular organs such as heart, viscera, and brain. Renal artery stenosis can be seen using perfusion techniques as well. Functional MRI. The rapid MR imaging technique that obtains images of the brain during activity or stimulus and at rest. The two images are made in sets and are subtracted, which reveals functional brain activity by an increase of blood flow to the activated cortex. This used to be performed with contrast, and now it just uses the blood. Blood has magnetic qualities. Hemoglobin, of course, contains iron, and blood transports oxygen, which binds to the iron. There is the oxyhemoglobin, which is bound oxygen, and that's diamagnetic, and deoxyhemoglobin, which is oxygen that is not bound, and that is paramagnetic. So the magnetic properties of oxyhemoglobin are suppressed, where deoxyhemoglobins are more magnetic. The paramagnetic deoxyhemoglobin creates an homogeneous magnetic field in its immediate area. This increases T2 star decay and attenuates signal from areas containing deoxyhemoglobin. It is important to remember how sensitive the brain is and its dependence on oxygen, as well as its relationship to oxygen, blood flow, and activity. Most important physiological effect that produces MR signal intensity changes between a stimulus at rest, and it's called blood oxygenation level dependent, or BOLD. So functional MRI makes use of the paramagnetic properties from deoxyhemoglobin, which causes a loss in signal. When oxygenated blood comes to an area of activity, it decreases the dephasing, thus increasing the signal. The effects are short-lived and require short scan times. The advantages of functional MRI are its uses in evaluation for stroke, epilepsy, pain, and behavioral problems. Thank you for watching. Bye.